Good morning, everyone. Thanks for attending our weekly call. This is Edward Ng, Director of IT with Pittsburgh Foundation. Just want to let everyone know this this webinar is being recorded and will be rebroadcast at a later time for public use. Please hold all of your, there's no need to raise your hand. Please go ahead and put any questions you have in the chat box or the question box there, and we will be sending follow-ups to your questions at the end of the webinar. With that, I'm going to hand it over to Phil Koch.
Good morning, everyone. This is Phil Koch, Executive Director of the Community Foundation of Westmoreland County at the Pittsburgh Foundation and the Westco Nonprofit Network. Glad you all are here with us for what I think is maybe our fifth or sixth call that we've had between our nonprofit sector, our human services sector, and those in our county that are leading the effort to support our most vulnerable populations. We're going to jump right in today. We've got a number of folks that are panelists that have joined us today that have agreed to speak. Just as a reminder to our panelists, if you could keep your comments to 5 minutes or less, that's really helpful to make sure that we all get out on time and get to the work that needs to be done. Today with us, we do have Dirk Mattson, as always, as well as Dr. Fox from Excella, Bud Mertz from Public Safety, Alan Blachowicz from Westmoreland Transit is here with us today to talk about transportation, which I know has been a question that's come up from time to time. Dr. Conway with the IU, Jennifer Miller, Deb Thacker, I think, is going to join us from Feeding the Spirit, as well as Lori Burnett-Levine, and then we'll round that out with George Mizikar from Excella, the manager of outpatient behavioral health. And I believe Tim Phillips is with us as well from the Drug Overdose Task Force. So just to jump right into it, from the Community Foundation's standpoint, just got two quick things. One, just a reminder once again that if you are finding yourself in need of management or of a operational grant to do your work, the Emergency Assistance Fund will close tomorrow at the end of the day. So if you have not applied for emergency assistance, that Emergency Assistance Fund, please feel free to do so. To date, we have approved about $715,000 in operational grants to nonprofit organizations throughout Westmoreland County. So that work is moving along, and we're trying to get those grants out as soon as possible. So if you're somebody that has applied and has not heard, you should be hearing within the next week or two, or next week, I should say, whether that grant application is successful or not. Second piece is just a reminder, and I'm sure Bud will touch on this, if you have needs for masks, we've set up a partnership with Public Safety to get masks into your hands so that you are protected while you serve your clients and those in Westmoreland County. All you'll need to do is to send an email, and we'll send out that email address after this call. You'll send an email to Bud's team, to the logistics team, along with filling out a form. You can request up to 1,000 masks at a time, and then you'll work with Bud's team to get those distributed to you. We've figured out a way to distribute those in a safe way without touch and without contact. So Bud may have more on that later on, but at this point, I'm going to pass it over to Dirk. Dirk, do you have anything for us this morning?
Yeah, I'd like to thank Bud Mertz for sniffing out some opportunities for us in behavioral health. There's some resources that are made available through SAMHSA, through the Department of Human Services that Bud made me aware of, and we're working together on trying to make those happen for Westmoreland County. We have a couple of, it was done on a really short timeline. We found out 2 days before we have to make a decision on which way we want to go that these opportunities are available. And we've been able to reach some conclusions. The Department of Human Service is going to send their proposal in within the next week or two to SAMHSA to get approved. So the opportunities, I'm not going to get into the specifics of it until this becomes more of a reality, though I will be making the commissioners aware of the details of it today. But we're not going to make any public announcement about what that is until we know that DHS got the grant money. So more on that later on. And there's some other things that Bud and I are working on together too. So some of those are pretty exciting as well. So I mostly wanted to thank Bud for all his keeping his finger on the pulse of this pandemic and redefining it now as a human service issue. still a public health issue, and they both go hand in hand anyways, but certainly more of a human service issue moving forward as the economic impact of this thing is going to hit harder as time goes on. So thanks for that, Bud. Also, the answers to the questions from last week are completed, but I didn't have an opportunity to get back to everybody on them yet. That's going to happen within the next day or so. Carol, if you're listening, your suggestions about someone from the unemployment office and somebody from the county assistance office, we haven't been able to identify someone yet, but we're still working on that and hope to get somebody on here that will address those issues that you raised. I thought it was a good question. So thank you for that. That's all I got, Phil.
Thanks, Dirk. Appreciate it. Couldn't agree more that Bud's team has really been finding opportunities and stepping up to the plate. So I echo your appreciation for Bud and his team. Dr. Fox, with Excel, I know you were on earlier. Are you still with us?
I am.
Great. Love an update. Go for it.
Good morning, everybody. I'm very pleased to note that the number of cases over the past 14 days in Westmoreland County is at 30 per 100,000 population, which is well below the number that the governor has set as indicating that a region may be ready to open. We have seen very promising downward trends in our hospitals as well as in our testing center. Our testing center, though, still is open if individuals are having symptoms and they need either an evaluation or to be tested. You can make an appointment at Fry Farm Road. You would call 1-800-727-9558. Excella has started to perform some surgeries. They're doing
Dr. Fox, we lost you. If you're still there, are you still there? Well, Dr. Fox came and gave us really great news and then dipped out. So hopefully she can reconnect if she has more to add. But certainly great news from the onset. So just for the interest of time, we'll go ahead and keep going on to Bud Mertz. And Dr. Fox, if you rejoin, just holler and we can get you back in there. But let's go ahead and move to Bud Mertz this time.
Okay, thank you very much. So yeah, a couple things. First of all, the Westmoreland County Department of Public Safety, as we mentioned before, went into the incident management structure in order to manage this disaster for the county. And I'm serving as the incident commander, so to speak, for my team. And I have a great team. I love the accolades that you've sent me, but I really have to acknowledge the fact that we, over the years with the commissioner's blessings, I have been able to form a great team that has really came out to shine with this. So I take a lot of credit for what they do, but it's really good. One of those positions within our incident management structure is logistics and resources. And as you mentioned, through the foundation and the purchase or donation of the masks that we got for the nonprofits, we're still managing that program. It's going well.
I'm in, we can hear it, but I don't know if I can talk.
And I think maybe Dr. Fox is back. Well, I'll finish up. Anyhow, so that program's going well, and if there is any issues that maybe something might get lost in the mail or whatever, in the email string or whatever, I'm always available and can facilitate making sure that gets put forward. What I really wanted to talk about, though, is what the next step of this disaster is. As Dirk, put it exactly, this was a public health crisis. However, through everything that I'm seeing, reading, I think that what's going to happen in our next stage is it's going to become a behavioral health crisis. And one of the initiatives that came out is when the president through a request of Governor Wolf, the president made a individual assistance disaster declaration to Westmoreland, or to the Commonwealth, and with that individual assistance, there was a grant that the president directed FEMA to push out for Pennsylvania, and that grant is for crisis counseling, and it's a wonderful thing for us, and it's the true application has to be made by the State Department of Human Services, but we're buying into it thanks to Dirk and the work that he put through in investigating it and picking the right choice for Westmoreland County, as well as the approvals of the commissioners. We're going to go forward with that, so that's going to be exciting. But I've been involved in disasters, I think, all my life. And in my prior life, I was the director of the State Emergency Operations Center that overseen the response and recovery of some of the worst disasters prior to this in Pennsylvania. But those all involve, hurricanes, tornadoes, floods, and so on and so forth. Those all had a benchmark that you can measure for a recovery. They all had a point where you could look at and say, look, school buses are moving. That's a great benchmark for recovery. Look, public transit's moving. Look, this business is opening, or look, these people are back into their homes. This is different. And we really, as we've been focused on the public health side of it, we have to acknowledge that there is a behavior health side of it that, I foresee what's will happen as we move from red to yellow, as the distance people have been without work, children have not been in school or had that structure, a whole host of reasons that this is going to then become a human service behavior health disaster. And sort of like we had on the public health side, that you expect a peak and you do everything in your power to flatten the curve, as the common term became. I foresee that we have to do the same on the behavioral health side. So our tactics still stay in place on the response side for the public health, but we're also going to add in our incident management structure, dragging more of the human service side in, dragging Dirk in into it, maybe forming a task force that we can identify where we really need to be on the behavior health side. How can we measure that? How can we identify any gaps? The whole issue of that. So I sent the proposal yesterday to the commissioners. They approved it. We still have a lot of work in trying to develop it. We'll be working with Dirk and members of our team on the best way that we can do it. We're going to bring it in under the incident management structure because, frankly, that's, in my opinion, the best way to manage disasters. And this is going to be a disaster. But it's going to be focused a lot on collaboration, the unity of the human services in Westmoreland County, and the collaboration of those services of how we can help do it. I truly believe that we're going to look at a peak, and we have to flatten that curve as well. So that's our next step into this disaster, and it's going to be a long and hard one, but I think that the right people are in place, and that we're going to move forward with it. So that's all I have right now. Thank you very much.
But,
Thanks.
This
Go
is
ahead.
Dirk. Would you mind talking real briefly about the governor's process for moving additional counties into the yellow phase? Kind of what you did before the phone call started, just real briefly, if you wouldn't mind.
Well, yeah, I mean, Commissioner Sorelli actually informed us yesterday that she had the dialogue with the governor's office, and that the governor's office advised her that his process is that he looks at things, and I can't define what the things are that he looks before he makes a decision, and he usually does that on the Thursday. But in retrospect, even if he does it on a Thursday, his past history that I've seen is that he doesn't make it for like the next day, or that he'll make a decision of that move, but he gives a week's time in between his decision and that change, so that the preparation to what you need to do in a yellow is there. I don't know if it's going to change today or not. I do know that, again, per Commissioner Sorelli's discussion with the governor's office, they're going to look at it today. I'm going to assume that based on the low numbers we've had of cases coming in, that we are soon to be changing our course. But I don't, and I'm only assuming that if he makes a decision for yellow today or tomorrow, that there's going to be distance between that of a week for preparation.
Thanks, Bud. I appreciate that update. Really helpful, and certainly on the behavioral health side as well. I know a little bit later on we'll be hearing from some of our other behavioral health folks as well. So to underscore your point. So thank you. I'm going to pivot now over to transportation. Alan was nice enough to join us to talk a little bit about how this is affecting transportation throughout the county and the response from the transportation side. Alan, you got an update for us?
Yes, thank you. You can hear me okay? Okay. First of all, we are continuing to run our fixed route Westmoreland transit service. We started operating a limited schedule on March 30th, but all of our local routes are still operating between 8:30 and 4:30 every day, and on Saturday, we're making sure that we're getting to the grocery stores, pharmacies, medical facilities. So that's still running. We are running a very limited commuter schedule to Pittsburgh. We have 4 trips going in the morning and 5 coming back out in the afternoon. And then our Route 4 runs in and out all day. We do have a very limited number of people that are going in to the city, obviously, to work, but they are essential workers, and we want to keep that service running for them. But it is available. On the shared ride program, the Go Westmoreland, the smaller buses that you all see out, that service is really designed for senior citizens and medical assistants and people with disabilities. That service is still running a regular schedule. People call it a day in advance and can schedule their rides. 2 things that we've changed there. We are now offering people the ability to schedule what we call a solo ride, so they're not being grouped with people. We obviously have a lot of people that have serious medical issues or older, and they're in a vulnerable population. We just ask that they have the ability to work with us a little bit on the timing of that, so that we can spread them out. We're also now allowing people to schedule trips just to go pick something up, whether it's a prescription, they can just run and pick it up and come back out to go home, or to go pick up food. So those things are now being allowed. That service, just for some information, we were doing between 700 and 900 trips a day normally. We're down now to between 200 and 250 trips a day. So it's clear that people have been sheltering and not going out as much. And the same is true on our fixed route service. We have about 175 to 200 people riding our local buses each day. and there's about 20 commuters back and forth to Pittsburgh. So the service is, there's plenty of room out there. If someone needs to use it, you can be far apart on the vehicles. We have instituted extra cleaning processes for all of our vehicles. Every vehicle is cleaned and disinfected every day. Once it's cleaned, there is a spray disinfectant that we're applying to the entire vehicle. We also have drivers reporting in if they do have a passenger that's visibly ill in some way, and then we will switch that vehicle out and do the best we can to get that vehicle cleaned as well. But every day those vehicles are being cleaned top to bottom. The same thing can be said for our facilities. The transit center in Greensburg is cleaned several times every day. And then we are also following all those protocols as well. If employees aren't feeling well, they're asked to stay home. Every employee is certifying when they come to work that they don't have any symptoms, that they haven't had a fever. All of our employees are wearing masks when they're around customers or other employees, and we are strongly encouraging all of our riders to wear masks as well when they're out using our service. I know transportation's been an issue around the county for a very long time. I've talked to just about everybody on this panel at some point over the last couple of years about transportation and what we can do. That hasn't changed. If there's needs out there, if your agency or you know people that need transportation, please don't hesitate to contact us. All of our information's on our website, westmorelandtransit.com, but if you reach out to me or to one of the panelists, please don't hesitate to ask, because we do have some flexibility right now, and we can work on other ways to help out. If there's anything at all that comes up related to this, please don't hesitate to contact us.
Thanks, Alan. I appreciate that. One quick question. I know that there was some conversation about at the transit center making sure that there are masks available for riders. Is that something that you all have available, or is that something that we could help with in terms of having some masks available for riders if they so choose?
We do. We actually have a couple of employees that have been making masks. The cloth masks, and they have been handing those out. We do not have a huge supply of masks to hand out, but that may be something. If there are, I'll say if there's extras somewhere in the system, that may be something that we could do as well. It seems that most everybody is wearing something. There's very few that aren't. So.
Okay. Well, I appreciate that. Maybe we can connect offline just to make sure that you all have them, just in case riders show up without them, just so it's a resource that's available. Maybe we can connect offline about that. Great. And once again,
that'd be great. Thank you.
Phil, I believe Dr. Fox has rejoined us on the call.
Great. Dr. Fox, are you with us?
I am. Can you hear me?
Yes. Continue on with the good news you were sharing.
So Excella has opened up and is providing some surgeries for individuals, as well as has opened up their office structure. We are being very meticulous.
Dirk, did you cut her off again?
Never cut Dr. Fox off, believe me.
Never cut off Dr. Fox. I apologize for those that are listening. I'm not sure what happened there again. But maybe Dr. Fox can, Dr. Fox, if you're listening, maybe you can send an update to Dirk that he can read, or I can read, or you can call back in again, either one. But thanks for trying. I do appreciate that. Let's move on to Dr. Conway, who's with us from the IU. Dr. Conway.
Thank you very much, Phil. So first off, districts and CTCs in the IU are continuing to implement their continuity of education plans and revising them as things go on. The biggest thing that districts are dealing with right now is how to deal with end of year ceremonies and traditions such as graduation. And we're hearing of some very unique, innovative ways to celebrate kids. For instance, our Clairview School is going to be doing a parade of teachers and administrators to all of our graduates who are all over the county and try to make their graduation as special as possible. And we're going to be doing that towards the end of May. Also, districts are beginning to think about what reopening in the fall may look like. Districts are beginning to create task force locally to talk about all of the different areas that need to be considered, if opening under a social distancing model. So other than that, last thing I wanted to share is the IU on behalf of the school districts was successful and with their request for information through the RK Mellon Foundation. So we've been invited to apply officially now for a grant that's going to assist with professional development of teachers, especially pre-K through grade 5 and 6, as well as provide technology resources to families that are in need. So that application is due on May 19th. So hopefully soon thereafter, we'll be able to share some great news. Other than that, thank you very much, Phil. That's my update for today.
Appreciate it, and really excited to hear about that, the proposal to RK Mellon, in tackling some of those issues that add to the opportunity gap for our children that are living in poverty. I'd love to reach out to you maybe after the call. We can talk a little bit further about that. I'm going to go ahead and move over to Jennifer Miller with the food bank. Jennifer, are you with us? Sorry, Jennifer. There you are. You there?
Yeah, I'm here. Can you hear me now?
Definitely. Go for it.
Okay, thank you. I was having a rough time getting on, and thanks to whoever helped me through that. So I appreciate it. Things at the food bank are doing okay. We are still operating all of our pantry sites. All but 3 are actually all but 2 are coming back on board that we were taking care of alone. So we're happy about that everybody seems to be coming through. Right now, we're pretty much status quo from last week. Our numbers are stabilizing, thank God, and we have about 11,000 dry boxes available to go out to our food pantry sites and for emergency purposes. We did give out 1,000 boxes to the Calvary Church in North Huntington for their big give distribution last Friday. And from what I understand, they are doing it again. They are not a pantry of ours, but they reached out to us for some assistance with getting some boxes for a mass distribution. Again, we're not doing mass distributions. We feel very strongly about having people stay in their local communities to help save on gas, and also, just to not make them go to unfamiliar territories. Especially when somebody is brand new to the food pantry distribution programs, it can be a bit overwhelming. So to have to stand in line or sit in line in your cars for hours on end, we felt it would be better just to keep everybody in their pantry locations in their communities. And it is working out very, very well. We are signed up to participate in the COVID farm assistance program, which is through the USDA. We won't be providing the packing the boxes so much as we will be distributing them. We, at this point, once we find out if we've been approved to be a recipient for any of those boxes, we will be doing a distribution, hopefully with the Westmoreland Fairgrounds. So we will be in a building on the fairground lots and have the cars drive right through to be able to get those. We're planning on doing those 2 times a week. For those who don't know, there's a few different types of boxes. One is a milk box, one is a produce box, one is a frozen meat box, and one is a mixed dairy. So it will include milk and cheese and things like that. We've actually, when the companies contacted us to see if we wanted to work with them, we actually just signed up for the mixed dairy the produce and the meat, the frozen meat. We felt that if the mixed dairy already had the milk, there was no need to get an additional milk box, because then you're talking about it spoiling and things like that. So once that happens, we will be putting that out to all avenues to advertise when that's coming, but we'll only be doing 1,000 households at a time. Probably about 2 times a week, or 2 times a month, I should say, if not more. We're going to stagger the distribution time, one in the morning and one in the later afternoon. So we're hoping to be able to connect with people who don't necessarily, quote unquote, qualify for food assistance. Right now, everybody qualifies for food assistance, but as things change, as the waivers run out, this program for the next 6 months will be for anybody. So we'll be advertising when that will be happening, and of course through our human service avenues, because we want anybody who needs it to come to the distributions. So we're unsure about how all of it's going to work, because it's something that was thrown at us very, very quickly. But if it involves getting food out to people who need it, we definitely want to be involved. So again, if anybody has any questions, please, address them to the site, and we'll be glad to answer them. But I encourage you to encourage anybody who needs assistance to contact us at 724-468-8660, and we will get anybody connected with the food assistance that they need. That's what we're here for, and we're proud to be able to do it. And I did want to give a small shout out to Excella Health. I guess all of you saw the newscasts that we finally got some press. So we're very happy about that, and for good reason. Excella Health donated, and it was the employees that donated $80,000 to the Westmoreland County Food Bank to help with food assistance during this time. So we are very proud to partner with Excella Health and all of the doctors and all of the staff there. They did a tremendous job in just 3 weeks' time. So we are very, very grateful to all of the community and all of Excella Health for seeing the need, seeing the urgency of food assistance during this time. So that's all I have. Thank you very much.
Great, thanks, Jennifer. Always great to see those acts of generosity during these times. Thanks for your report. Dirk, I know that Dr. Fox sent you a message to finish her report on her behalf. Dirk, can you update us on the rest of the Excella report? And I won't cut you off, I promise.
I'll do my best to try to fill in for her big shoes. So here's what she says. They've just resumed elective surgeries. People were wearing masks, and they have enough right now. All elective procedures are COVID tested in advance, so they know exactly what they're dealing with at the hospital. They've done scrupulous cleaning throughout the hospital. It's been a high priority for them. They're taking social distancing seriously at Excella. Concierge to help with things if somebody comes in for any kind of need. They have adequate PPEs and resources. And she also says, not sure if we heard this, but testing on the Fry Farm is still open for those who need it. So that's Dr. Fox's update. Thanks, Dr. Fox, if you're still listening.
Yeah, thank you. I appreciate her. I definitely appreciate the information and her persistence to make sure that we get the information we need. So thank you. We were on the subject of food. We had heard from Jennifer Miller. We're going to pivot over to Deb Thakara with Feeding the Spirit. I know that you all had a successful Saturday, but I'd love to hear more. Deb?
Hi, can you hear me?
Yep, go for it.
Okay, thank you all for having us on again. And we had a very successful Saturday. It was our third emergency distribution at St. Clair Park, which is every Saturday at 2 p.m. from 2 p.m. to 3 p.m. We were able to distribute 590 meals, which was a huge jump from our first week, which was 200 meals. We partner with a lot of area restaurants, and they have been so gracious. We also partner with the nutrition group and get frozen meals. The diaper bank came to distribute diapers. We had Wayward Whiskers come with pet food. We had Tim Phillips came with some Narcan kits, which was great. So it's really become a community event where in a very short time, 2 o'clock to 3 o'clock, we can distribute not just the food, but maybe some other items with some other agencies as well. We obviously do it safely with social distancing. Everybody wears masks. We have masks there. So we're very happy. If you don't know what Feeding the Spirit is, for those of you on a call that aren't familiar with us, we've been in business 9 years as a nonprofit serving the community a free meal every week. And also we do emergency crisis placement for homeless people. We step in with rent eviction. We try to reduce the barriers that stop people from getting ahead. So we partner with all the other agencies. What we have seen this week is less crisis calls for food, which I think is very good. I think everybody is learning the resources, whether it's the food bank, whether it's us, some other agencies. So I think that that number has gone down, and I'm really happy about that. And we're happy to see more people coming to get our meals. What has gone up is the crisis placement for homeless people. We're seeing more of that, and that's very sad. And I think you were talking about, Bud Mertz was talking about the human service crisis and behavioral health crisis. I see the ripple effect. Our board, and we're very worried about that ripple effect causing more homeless. The families that are joined together and pulling together under one roof, they're all sheltered there, and tensions are high, and resources are low, and food is scarce, and children aren't going to school. So some of the families are asking their other family members to leave. So we're witnessing a lot of that now, which is a little different. And we know that that's only probably going to increase. So that's pretty much all I have, except that I did get a call from Mel from 412 Food Rescue, and she is very interested in partnering with us and the food bank and maybe some local restaurants to have their drivers distribute food to rural areas if people can't get it. So that's something that we're working with, and Jennifer, I think she's probably going to reach out to you folks as well if she hasn't already. And that's kind of an exciting call to have, because as you know, that there are a lot of people rurally or people elderly that just can't get out to get the food, and they want to offer their services that way. So I think that's it for me. Thank you.
Great, thanks, Deb. Speaking of those that are experiencing homelessness, one of the things that we probably that would be helpful to mention is that I know Dirk and his team, as well as a number of folks from Westmoreland Community Action to Union Mission and others, have been working on establishing an isolation and quarantine shelter. So that is in place. So if you have folks that are truly homeless, that have tested positive for the coronavirus and need isolation and have nowhere else to go, there is an emergency shelter that's set up. You would connect to Bud Mertz and his team. Public safety is the front door to getting access to that shelter. They do a sort of an initial screening and understanding of the situation to make sure that the quarantine and isolation shelter that we've established is the appropriate next step. So just a quick heads up on that. Dirk, do you have anything else on that piece that should be mentioned? I know that we didn't mention it earlier and it probably should have been discussed.
No, I don't think so, other than to say the location isn't going to be publicly disclosed. So
Right.
I just wanted to mention that we're not being secretive about it. We just want to be, for a number of reasons, cautious about disclosing where it is. So just an important piece for everyone to be aware of.
Great, thanks, Dirk. Appreciate that, and thanks, Deb, for your comments. We're going to move on to Lori Burnett-Levine with Mental Health America. Lori, are you with us today?
Yes, I am. I hope you can hear me.
Can hear you loud and clear. Go for it.
Oh, good. Thanks so much for inviting me to speak today. I really appreciate the opportunity. For those of you that don't know me, I'm the Executive Director of Mental Health America of Southwestern Pennsylvania. And we're an organization that provides education, advocacy, and supportive services for individuals throughout Westmoreland County. I, in a strange way, was pleased to hear Bud Mertz's comments about the impending behavioral health needs that we think we're going to see in our community. I know there's lots of medical experts, mental health individuals, and human services professionals on the call. So I'm going to share with you some information that you may already know, but my goal really is to highlight certain information I think that'll help us understand and think about what may be to come. So just as our communities had to prepare for the virus and the physical consequences of the virus and its spread, we also need to think about the behavioral health implications of the virus and the impact that it's really going to have on our community, our nation. A perfect storm for mental health is brewing. The experts warn that we're going to see a historic tidal wave of behavioral health problems. I know I really sound all gloomy and doomy, but this is really what the research indications are showing us and what we've learned from past experiences, pandemics, natural disasters. What we're experiencing now, as you know, is really unprecedented. The social isolation that we've had to participate in, the really physical isolation, but there has been some social isolation. So this has really led people to be experiencing feelings of loneliness, which exacerbates and really increases mental health problems that people may already be experiencing. Things like depression, anxiety, and suicide. So unfortunate as it is, that is the truth. The research has shown that loneliness and social isolation put people at a greater risk, not only for mental health issues, but physical health issues. The mental health issues are strongly associated, again, with depression, anxiety, self-harm, suicide attempts, and completions, and PTSD. And I know Tim Phillips is on the call, also drug overdoses and loss of life from addiction. So those are some of the things that I wanted to highlight. Nationally, since 2007, the rates of suicide have nearly tripled in youth and young adults that are 10 to 24. So as you may know, because if those of you have heard me talk, suicide is the second leading cause of death in young adults and those 18 to 34. Social isolation increases this risk. So individuals and family economic concerns, they also increase this risk. Older adults, especially males, our veterans, and those who identify as LGBT are at higher risk. And we know that southwestern Pennsylvania has an awful lot of older adults. All of a sudden, for people, life as we knew it has changed. Things that we took for granted are no longer possible. So after people experience the crisis phase of a response and life draws down to regular activities resume, all of a sudden people start realizing the additional unmet needs that they have and the further ramification of these needs. We know we've seen tremendous unemployment, job loss, which also leads to financial hardship. Those are things that contribute to mental health problems and suicide. We saw during the last recession in Westmoreland County that the number of suicides increased. Nationally, suicides will continue to increase, and locally, I believe, unfortunately. So some of the things that I think that we have to do is some of the things that we're already doing. I know that you're applying for a grant, Dirk, and with Bud, and I think that's really important because people are really feeling the effects of this. I mean, I think all of us are. Increased anxiety of the unknown, what's going to happen, what's going to come. People are feeling agitated, like you're seeing people beating each other up on the news because someone's not wearing a mask. People are having trouble sleeping. There's a federal emergency hotline for people in distress. They saw a 1,000% increase in April from the same time last year. 20,000 people texted the SAMHSA hotline last month. So I think that those are some things that we anticipate that we're going to be seeing. And this it usually follows. It could be weeks, it could be months, it could be years behind the catastrophic events. It doesn't usually happen as much during the event, but as the event is winding down. So I think because of this unprecedented pandemic, that the toll is really going to be great. We know that 1 in 5 Americans are already impacted by a mental illness in any given year, and only half of those receive treatment. Our national organization, Mental Health America, has seen an increase of 70% in the online anonymous anxiety and depression screens that they are giving. So as we're engaging in all this doom and gloom, I want to say that there really is hope. I think we as a county are becoming prepared, and that's so important. We will need additional funding for additional services. Interventions can make a difference. We need to continue. I know that this county, and I've participated in it, has done an awful lot. That's part of our mission, to educate people about mental health issues and the importance of them getting screened, having access to treatment and support. Mental Health America does have a behavioral health advocate, and that advocate is still working remotely. That advocate can be reached through our agency, 724, let me see if I can remember our number. So you can reach us at 724-834-6351. And her name is Pam, and she is taking calls and is available. Some of the things that we have seen is the stressors that parents are experiencing now, having children at home. What we're seeing is that the crisis services now are the ones that people are using, but that we hope that eventually people will move to seeking out services. Also, May is Mental Health Month, and May has been designated as Mental Health Month by our national organization. And our tagline is "There's no health without mental health." So I thank you for inviting me to speak today. We're here to assist you. You can also call me at that same number. We're monitoring our calls, and we're here to help the community. So thank you very much, and thank you for inviting me to speak.
Thanks so much, Laura. I appreciate your time and the update. Thank you. I'm not sure if George is with us from Excella. I know he was going to join us today. I'm not sure if he got held up. George, are you with us today? Okay. We're just gonna we'll go ahead and see if we can get George on for next week. Who's again the manager of outpatient services for behavioral health at Excella. So we'll try to get him on for next week. Tim Phillips, are you with us? Do you have any updates from the drug overdose task force that you want to provide?
Good morning. Yeah, hi, it's Tim. I do, Phil. I just want to echo everything that everyone has said. I guess, you know, we're continuing to deal with 2 pandemics, but the good news is that, and I guess it's somewhat good news, in our first quarter in Westmoreland County, our overdose deaths seem to be in line with last year's rates. So we don't see any spike at this point in time. However, as I've heard a few other participants echo, we are anticipating an increase. The surrounding counties have indicated some increases recently in overdose deaths. The first quarter in Westmoreland County, we were at 32 unfortunate overdose deaths. And that's still too many, believe me. We still have a long way to go, but we are online and we're not seeing any increase in spikes at this point in time. We are seeing an increase though in relapse rates. And recently we've also seen an increase in neighborhood, I guess because people are sheltering at home, they're seeing more activity in their neighborhoods with suspected drug activity. And so I was with our detective, Tony Marcacci, yesterday discussing some of these issues and what we're going to do as far as reporting and investigating those issues. It's been an interesting a week with those things happening. We also, distributed a lot of Narcan in the last couple of weeks too. I want to thank Deb again for inviting me to go out to Feeding the Spirit on Saturday. We'll be back again this week, and we're also doing a lot of pop-up Narcan drops around the county. We're also allowing our team to provide Narcan no-touch porch drops as well. So we can, if you give us your address, and we can give you the training if needed online, and we'll drop the Narcan at your porch residence. We've also contacted a local pharmacist, and they have agreed to, if you have a prescription, you don't need a prescription for Narcan. If you have insurance, you call the pharmacy, they'll run your insurance and mail that to you. So we can get that done to you via mail as well. So you can contact me for further information if you'd like to find that. I also got to say, and I think I talked about this last week a bit, the correlation between unemployment and the deaths of despair that we're going to be seeing. Right now, we predict that there's probably at least 21 million people in this country that suffer from addiction. That's about 1 in 7. And when we talk about this behavioral health issue, it's for real, and this is going to definitely spike up. With the rates in unemployment, we see that the data suggested that for every 1% increase in unemployment, that was associated with a 3.6% increase in opioid-related overdose deaths. And so we really have a lot of work to do to be proactive and do what we can do so we're prepared to not see this spike here in Westmoreland County. We're also seeing some issues with our reentry folks, but we're working on those. That's people coming out of institutions, accessing services and supports as well. So we've kind of got a little bit of a disconnect, it appears. We're trying to patch that up as best we can. So yeah, we're kind of busy with a lot of this stuff, and I look forward to finding some solutions when we can. Thanks for the invite. That's the update from me.
All right, thanks, Tim. Appreciate it. Thanks so much. Well, I think we've come to the end of our agenda. Once again, I appreciate all of the folks that have joined us today, especially folks that haven't been with us before. Alan, thanks so much, and Lori. Dirk, do you have anything else before we close out for the day?
Nothing, Phil, thanks.
Great. So at the very bottom of your page, you can see the website, the link to the website there. If you need a recording of this, it'll be up there in the next couple of days. And also any of the resources that were mentioned today on the call will be available through that site, as well as the answers to any questions that you submit on the panel. So thank you so much. We're getting through this because of your work and because of your commitment to all of the vulnerable folks in our communities. So thank you for all of your time for making sure everybody's safe. So with that, we'll close it out. Feel free to reach out if you have any questions to myself, to Dirk, to any of our panelists. We're all here to help. Thanks so much.